So just like adults, children need support because they also go through different distressing situations. And as adults, we need to be supported emotionally. And that's exactly the same situation as for children. So especially when they go through traumatic or distressful situations, they need to be supported emotionally. They need to be taken care of and make sure that they are able to cope with the situation they are going through. For children, it's a bit more complex because they are not fully able to express themselves. So you need to pay key attention to signs of distress, and of course make sure they feel free to share with you what they're going through. Just like adults, they also go through emotional situation, especially after a crisis such as accidents, migration situation, and all other situations that they go through. In fact, a small issue as being bullied, even the minor bullying in school, that can cause distress for children, and they need psychological first aid. So it's important then for us as caregivers, such as parents, teachers, or even doctors or healthcare workers, to make sure that we recognize or we see these signs of distress and we are able to jump in and offer psychological first aid, which will help not to go to the next stage of needing medical or professional help. So psychological first aid can help children in various ways, and let's look at 5 key aspects that we can actually summarize and say it can help children. Number 1, it helps in stabilizing their emotions. So for children to recover from any distressful situation, we need to make sure their emotions are stable and they are able to cope with the situation. We also need to promote safety and calm. Again, for you to go through well on a certain stressful situation, you need to be calm, you need to feel safe. This could include psychological safety or even physical safety. So as caregivers or people who are supporting children, we need to ensure that these 2 aspects are taken care of. Number 3, we need to encourage healthy coping. As you know from mental health and psychosocial support angle, you can cope with various situations in negative or positive way. But for us, we need to promote the positive way of coping. So through psychological first aid, we are able to support children to be able to cope positively. Number 4, we need to encourage connectiveness and support systems. So once you offer psychological first aid, your main goal is to make sure that it's sustainable. And the only way to sustain this is to make sure they are well connected in the community. This could be their schools, this could be their homes, or even where they live in, the community they live in. And finally, our ultimate goal is to make sure that we prevent long-term consequences or long-term effects. We don't want any distressful situation to escalate to PTSD, post-traumatic stress disorders, or even depression. So we want to arrest the situation as early as possible. And this is only possible through provision of psychological first aid.